Welcome to today's webinar, Building Connected Healthcare Experiences. I'm Jane Weber-Brubaker, Executive Editor of Plain English Healthcare. We are the publishers of Strategic Healthcare Marketing and eHealthcare Strategy and Trends, and producers of the eHealthcare Leadership Awards. Today, we're fortunate to have innovators from PK who will share their insights on how health systems can engage with consumers through content hubs that connect experiences, and how to create a structure for content that is flexible and scalable. And now I'd like to introduce our speakers for today's presentation. Derek Phillips is Director of Content Strategy at PK. With nearly 20 years in the industry, Derek has worked across several verticals and helped build content disciplines for a variety of organizations. Derek has taught foundational and advanced content strategy courses at Portland State University, and for several years, co-managed the Content Strategy Meetup Group in Portland, Oregon. Dave Wieneke is Healthcare Innovation Director at PK and publisher of the agency's annual Hospital Digital Index, which benchmarks the state of digital play across top-ranked hospitals. Dave is a graduate of Penn Medicine's Business of Medicine specialty, and he teaches healthcare marketing and digital transformation at the Rutgers Business School. This weekend, Dave will be a mentor at MIT's COVID-19 Challenge, a virtual hackathon. Jeff Cram co-founded Connective DX, which joined forces with PK in 2019. Jeff currently serves as a partner at PK and general manager of the Boston office. He's responsible for helping to shape the Boston office's strategic direction, partnerships, and service delivery. Jeff is an active member of the digital community as a blogger for Fast Company and a frequent speaker at national events on topics including experience design, analytics, and content management. Today's discussion will be approximately 45 minutes, followed by a 10 to 15-minute Q&A. To submit your questions, type them into the control panel and hit send. We'll hold your questions until the end, but please feel free to submit them at any time. This session is being recorded, and you'll receive a link to access the recording as soon as it's been processed and is available for viewing. And now I'll turn it over to Dave Wieneke from PK. Dave, please go ahead.
Thank you very much. It's great to be back with you. Derek, Jeff, and I are all thrilled to be with the 80 or so people who are gathered live right now. And thank you all for joining us today. I'll give you a quick flyover of where we're headed, which is briefly some introductions of who we are. But quickly beyond that, to talking about the digital state of play, both as we see that from our HDX research and also from some client work. And out of that is going to come an idea of three content structures that can be useful to healthcare marketers and communicators as they try to create better engaged healthcare experiences and gain the loyalty and ongoing relationship that they seek with patients. Derek and Jeff are both going to be talking about how that plays out through content teams and also through some of the technology trends that we believe are accelerating this shift, which is a shift from making pages, making apps, making emails, to instead creating joined together experiences, which are in fact more than the sum of those parts. And we're looking forward to talking with you about that, and hopefully having some cross chat, just as we talk through this with you. So great experiences really rely on, both strategic vision, which informs masterful doing, and using strong technology to make pioneering experiences that matters to organizations and people is what our team PK is about. And just to introduce them, because this is the first time I believe that we've done a webinar as PK. It's an organization that's been global since birth and is really recognized by analysts for helping clients increase customer value. And we work in tandem with partners like Google and Sitecore, who's featured here, and partner with them to make these outcomes for the teams we partner with. One of the things I've come to believe is that agencies tend to become what their clients teach them to be. So it's important for us to recognize that this team has gotten here learning together with some really remarkable customer-centric brands. And as you look across these, you'll see the healthcare practice over on the right, features providers up on top, some payers in the middle, and some examples of device and service firms down at the bottom. And we're going to draw on examples from two of these, the ones I've highlighted in blue. Kaiser Permanente is really both a payer and a provider, and we'll be talking about both sides of that organization. And Zimmer Biomet is a device maker. So we're going to be talking about all three of those components in healthcare marketing. And we'll draw in also lots of examples from the ongoing research that I mentioned. And that's what we're going to do to start out here. As you may know, we publish an annual report that looks at the state of play across top hospital brands. So besides working with the leaders, our team does this ongoing research, looking for great work happening by teams like yours. And yes, our baselining report does produce some quantitative measures of these qualitative experiences, but it's also just a great way of focusing on the state of play and how it's changing in our space. So we've applied this technique to probably 6 systems now. And naturally, because we're living through what really are historic times, we went back and we wanted to see what's changed in the last few months as these great brands have worked through the pandemic, which is so much defining our lives. It's probably no surprise to anyone on the call how dramatically telehealth has been adopted. The two stories that I've come across is one large telehealth provider who talked about 3,000%. That's a 30x growth that they've endured in 60 days. I also talked to a hospital executive who described their system last year having 1,900 telehealth visits. And this month, they've had 1,900 visits. And they're making plans for next year to do 1,900 visits a week. So a year ago, we would have seen telemedicine as a campaign. And now it's really become an important site of care. And as the systems that we talk to have the goal of building this in as a foundational campaign or a foundational capability, something that's not going to weigh and in fact is going to become more and more important. And just as kind of our first challenge to the eHealthcare marketers here, I want you to think about that we're living in an age where video is now a crucial point of care. So as we think about doctor finding, how long will still photos and a few historic or demographic facts really measure up on profiles as a way of picking a doctor? Now, I can think of 4 or 5 systems that for years have been applying themselves to capture video and start to deploy that. But I have to imagine that the explosion of telehealth really must be a lot like a starting shot for systems that haven't been doing this to be starting to use video in how you pick a doctor, because more and more patients are experiencing them that way. The other large change that we saw, and this was true on about 20 to 25% of the top sites, is the introduction of chat with an AI interface. And rather than doing a deep dive on that, I just think that if you look across how dramatically both the sites have changed, but new technologies have been adopted, that we can be proud as an industry that we've executed immense changes under really hyper demand situations. I have a UCLA health site up here because, like many of the teams on the call, they've put up this very robust AI chat solution from Loyal, and they pulled it off inside of 2 weeks. And I understand that it's supporting over 30,000 interactions a day with their team involved every day in optimizing that. So if nothing else comes out of COVID-19, I hope that it starts to end the trope that healthcare's digital vision is somehow backwards or slow. There's a little bit of a dot-com smug fest that because healthcare isn't a digital native, that somehow it's not making progress the way other, frankly, more simple companies can, who are simply reselling the products manufactured elsewhere. So there's plenty that we can learn from others. But honestly, what the healthcare industry has done, what other industry is shifting so fast, I'd ask.
Yeah, hey, Dave, just real quickly on that point, I think it's really interesting how quickly healthcare has adopted some of these changes, to your point, right? Like we see a lot of the trends initially maybe had started within B2C, but now we're seeing the healthcare vertical really accelerating their adoption of digital in response to really what patients are looking for and what they need.
Yeah, absolutely. And with this level of innovation, I think we're going to look at the status quo that we're returning to with a fresh pair of eyes. The world's changed, but big parts of our reality haven't. One of my favorite clients refers to their organizational structure as silos of excellence. Does this feel vaguely familiar to how you think about healthcare experiences? This really is a challenge to stop thinking about creating just some pages or just some emails or just answers to phone calls, and starting to connect our resources together so that they create better integrated experiences. For instance, people with questions go to our websites, which are over here in Silo 1. Portals are in Silo 2, and call centers are in Silo 3. They all have people with questions showing up. But does the call center really leverage the web facts, or better yet, correct and update them? Or maybe better still, add to them so that they reduce call volume and let people self-serve? We could discuss a whole series of benefits from creating greater interoperability. But just one more. Imagine in this arrangement of content how easy it is for an article or an asset to become stranded and undiscoverable across this kind of rat's maze architecture. It really makes me sad to think of consumer intent getting stranded in this way. And likely we all recognize the fact that that stranding isn't lost on the consumers.
Yeah, and hey, this is Derek. Just one more point on that, Dave, and then I'll be quiet because I'm going to get to
I'm glad you're with me.
Right. But this also poses a lot of challenges for the content managers on the healthcare side. It's a lot to keep track of all of these various channels, all of these various points of interaction when they're siloed like this, when they're disparate like this. And so we'll talk about some solutions to that. But I'm sure we have a lot of those content managers on the call today, and this probably looks familiar to them as well.
Absolutely. And those disconnected experiences, they really play out in a disconnection that happens with consumers. Now, this is a picture of a real guy. And I want you to know, I first saw this shirt and I thought, wow, how rude. And then about 10 seconds later, I thought, wow, every marketer in every industry needs to see this shirt and imagine their target persona is wearing it. So according to some recent Forrester data, which is on this slide, despite colossal investment and effort, only half of online adults have logged in for healthcare websites or apps. And of that half, only half of them have done so in the last year. So that's not a very high rate of return. And less than 20% have scheduled online appointments. These are foundational capabilities that systems have really worked to stand up. And what's interesting is I want you to think about what we've just seen with telehealth, how it gained a huge adoption because it was tremendously useful and necessary. And now that we've seen our consumers do that, how can we see the future of care being supported by systems that likely aren't that aligned to consumer needs, which is driving this behavior that we're seeing from people like Forrester? So we know consumers want useful consolidated interfaces. One example is in financial health. Mint consolidates through APIs so people can see all of their account information together. In entertainment, I'm sure all of us have struggled to find a way using smart sets to see everything that's available from the things we subscribe to. So the good news is that there are organizations in healthcare already innovating on this path. And we're going to highlight them. And we're going to do that by looking at three approaches that we see them using. The first is a term that we've heard clients use probably for the last 6 or 7 years, the digital front door. But Forrester Research has been publishing against this in healthcare. And it's really taking a macro view, sort of like those silos, of connecting systems across the healthcare ecosystem with the goal of reliable, useful brand experiences. So that's kind of the large macro end result, which obviously isn't delivered by truck and doesn't happen in a day or even a year. But the step towards that is the engagement hub. And they focus on engaging just a single audience with the goal of ongoing interaction. And this is an idea that frames work going on at Gartner Consulting, and we'll talk about that. And finally, the smallest, most atomic step in this process is perfecting interaction points, things that advance customer interactions with the goal of a conversion. So we'll dig into each of these as we go through, but most important, we're going to look at teams that are using these approaches and changing the way people experience healthcare. So the big goal of the digital front door is to unify the ecosystem, which are very ambitious, amorphous sounding goals. So I want to kind of take you back to the source of where all of this started for us, and that's at Forrester Research. Ariel Trzynski and Annalise Clayton have really made this part of their research beat on healthcare change. And you can see in the middle here's the definition of the digital front door. And an example of 21 systems, these boxes that are mostly focused on the easier to address journey in the access to care. I expect many of you could probably double this list with just a few minutes of reflection, but it really is a good starting point. And I want to, if nothing else, make the point that these boxes become far more impactful when we integrate them by starting to add some arrows. And here's one simple example of that. This is part of the conversation where I should probably stop and explain, I've done this. I've built both large marketing teams and personally done the integration that you see illustrated here. So this is something that people can do. This is also something that IT teams can take on, and we have an API strategy practice that looks at the API as a important cultural and management part of the technology ecosystem. So you can do this yourself. There are others who can help you. But let me walk through a simple flow. If you start out with the green one next to the CMS system, a visitor to the website fills out a form, which the website produces, and it sends the data to the customer relationship management system. And the preferences that they indicate on that form get used by email marketing when it's time to pull in content based on the information that they've indicated. So it pulls in education materials, perhaps a brand video, and they're made available both in the email, but then later in a pane when the patient authenticates into the system portal, because that's still important information that would be beneficial for them to hear about. So interoperability is how these kinds of connected experiences can be better orchestrated. And there are 3 steps on that trail that I want to call out. First, things can happen iteratively. So this is almost always prioritized on the audience that's most important to you at a moment, a key audience. Second, interoperability allows you to click in integrated solutions. So this isn't, please go buy one system that rules them all. Indeed, what we see large enterprises in healthcare doing is buying best-of-breed solutions that collaborate with each other well and create a federated, assembled experience. And then finally, everything that we build, whether it's integrated or not, really needs to have built-in feedback mechanisms. And that's how we manage and run the future using the things that we build. So let's take a look at two of these ecosystem-wide digital front doors in the wild. We'll look at Kaiser and Intermountain. We've learned a lot working with Kaiser Permanente over the years, so you'll hear about them a few times today. Their work here really illustrates the degree to which the path to care is mobile first. And you can see that there's a focus on joining, accessing care, managing and paying for that experience, and then managing health beyond the care experience. And care increasingly is happening through these technology intermediated portals. So besides accessing care geographically, video visits with patients, voice visits by phone, chatting with a health AI bot are all ways that care is also being delivered through their mobile experience. And at each step of the journey, they're judiciously building digital experiences that are mobile first and ready to engage their patients in a brought together, joined up healthcare experience. You can also take a look at Intermountain. I just love this interface for blood pressure. I'm not sure how many of you can think of what your blood pressure was the last time it was checked, but I might know that if it was on a device and made useful for me. Intermountain has fielded this integrated digital front door as an experiment for a part of their patient load. They're testing to see how these integrated functionalities work for their patients as a single solution. And the beauty of digital front doors is they're more useful and engaging than one-off apps. So there could be the healthcare ERM record and billing and messaging, but once you start to put these capabilities together, they become more of the sum of their parts. And what's been impressive about Intermountain and My Health is they're very forward about describing this as a digital front door. That's their North Star that they're working against. And they're really one of the leaders in innovating in a number of areas, but particularly in this joined together digital experience. So those are digital front doors. We touched on them. Engagement hubs, you'll remember, are just an audience slice of that ecosystem. So this can be the first step towards the digital front door. And this is an approach that Mark Gilbert has been advancing over at Gartner Consulting, the idea of healthcare consumer engagement hubs. And not surprisingly, the eHealthcare strategy and trends people have been right on that and have been covering that on their pages. So this may be an idea that's familiar to you, or you can read more about it if you're subscribing here. What we're going to do is take a look at a few of these in the wild. And this is a sampling of the ways that engagement hubs get used, from preparing patients for surgery, women's health, wellness. We won't be diving in on chronic condition journeys, but if you think about the fact that 6 of 10 patients have a chronic condition, that's a really important way to segment the way you talk with people and make it more relevant, and would be ideal to address with content hubs. So let me turn to Derek, who's going to talk a little bit about work with a medical device company, Zimmer Biomet.
Yeah, thanks, Dave. So Zimmer Biomet has taken a really interesting approach to their engagement hub or their content hub here. And what it is it's a really clear illustration of their focus and their commitment to patient health and how they want to be a partner in that patient health. Now, what's interesting about this is that Zimmer Biomet does not sell directly to patients. It's not like you could go to their site and buy a knee implant or a shoulder implant. But again, what they wanted to do was to be a resource for those patients, and maybe more importantly, to be a resource to the surgeons who are working with these patients. They had found that patients or surgeons rather are often struggling with setting realistic expectations with their patients. They think sometimes I'm going to get a knee replacement at 60 and I'm going to feel like I'm 19 again. And the reality is you're going to feel like a healthy 60-year-old. But they also compete with all of the sources of information, some good, some not so good, out on the web. And so Zimmer Biomet really saw an opportunity to become a resource for those surgeons to provide to their patients reliable information that sets realistic expectations. And so how they did that was really to launch this magazine-style engagement hub that also has a lot of social reach. So it helps to really feed their social media channels. And so they created a comprehensive content strategy and editorial approach, but it's journey-based content, which I think is really unique and interesting. So as you can see on the screen here, when you come to the home page, I want to know more about, and then you can choose where your interest lies on surgery, recovery, healthy living for hips, knees, chest, whatever it might be. Wherever your interest lies, that then kind of sets the tone and curates all of the content for the patient at that point. So you can see, we can look at things, diagnosis, and what are your options? Are you pre-surgery or surgery? Are you in recovery mode? Or are you in the healthy living phase, which is post-surgery and just making sure that you're living a healthy lifestyle? They've really invested a lot in creating this pretty unique magazine-style experience for those patients.
Hey, Derek, can I ask you a question? I'm curious, since Zimmer is a B2B company primarily, how much do they know about their customer journey? And how did that happen so that they were able to orchestrate this experience?
Yeah, so they knew a fair amount about their customer journey, the patient journey, and even more about, obviously, the surgeon's journey, because that's really who their main point of contact is and who their buyer is, either surgeons or procurement people in large medical facilities. So they knew a fair amount about that, but we worked with them and highlighted some interesting intersections for them. What I think is the better illustration of their investment here in this, though, is really that they have brought on an editor-in-chief who manages all of the content, the editorial direction, and making assignments, and bringing in actually contributors who are surgeons or other medical professionals to create this content. So they're really treating this just like a consumer-facing publication.
Great. So this is not an evergreen resource. This is, in fact, a constantly publishing media hub.
You bet. In fact, they're looking at their analytics every month to see how content is performing, and that's being worked back into their editorial production schedule.
That loop of content authors being constantly informed by analytics is so important. I was with people at Adobe fairly some time ago, and their content teams there are supposed to spend 15% of their day focused on learning from analytics so that they can write and improve the content that's part of their remit. So definitely a key plugin.
Yeah.
So, like Zimmer, providers also have this really important B2B relationship with their referring providers. In many of the systems we work with, half of the system revenue is connected to referral. And like the example that Derek just showed, in this case, UPMC uses education to deepen relationships and influence this important part of their business. And they've stood up a wholly separate domain for their referring provider experience, which really is a classic content hub, in that when someone comes to it, they identify what medical specialty they're interested in. And for the rest of their visit, until they change that focus, they see unique claiming around U.S. news, just around the specialty that UPMC is practicing, to research publications, video rounds, and the CMSs targeted to the specialty that the provider shows interest in. So here, this is a great example you can see over on the right of educational material being brought in for continuing medical education, very typical engagement, but what they're being shown lines up to the interest of the specialist. So that's a really practical place that you could launch a content hub. Likewise, Orlando Health, like many systems, they've built a newsroom where they aggregate and put out a lot of their own original messaging, often about wellness. But Orlando really stands out for taking both a life stage approach, which you can see that there are 5 life phases. So that, a lot like Derek's example, is asking people, at what stage of system engagement are you, as well as a very high number of clinical topics and wellness interests, all of which, once the website recognizes that that's what someone's interested in, they're able to see an experience that's built around that. Now, as it happens, I think this creates a natural SEO intersection as well. And for sure, if you're a content marketer, you'd recognize that a name that contains the geographic modifier like Orlando, along with 28 clinical topics and 18 wellness interests, really is SEO fodder and a great way for this system to be found and in some cases be relevant in between episodes of care. So that's a classic engagement hub. Just touching briefly, many of the systems that we follow in HDX, Johns Hopkins and Barnes Jewish, I believe, have launched women's healthcare hubs. And that makes sense. Women are a majority purchaser and planner of care. So the idea of treating women through their life cycle and providing information, not just about health, but also about ways to be involved with a foundation, to be involved in research, and to understand changing payment opportunities is a much more brought together experience than having to go out and find these things individually. So finally, those are engagement hubs. There's great work going on. We'll touch briefly on the smallest atom of change, and that's interaction points. And again, interaction points are different than engagement hubs because they're just focused on moving a particular audience member from step A to step B. There's not an emphasis in coming back for repeated engagement. And you might see that used in something like selecting care. You traditionally don't come back and repeatedly select doctors. You don't repeatedly authenticate to the patient portal for the first time. And although you might use a wayfinding app many times, often people learn the way to care, and that's okay. That's just a resource that's there until people can navigate. So I want to show you 2 world-class examples of this. Actually 3. Kaiser Permanente, both as an insurer and as a clinical leader. This is a classic interaction point. They've chopped their paper-based new member onboarding from being a 6-week-long process to a same-day process. And they did this by digitizing it. So what would engineering this kind of engagement point get you if you were a payer? Well, members get care faster and with less bother, so for certain there's a level of customer satisfaction there. But it also turns out that getting members to use resources, well, it helps with their health, that helps with cost, and it helps with retention. So this is an easier experience for a more valuable relationship because it happens fast and you get care faster. It's the kind of progress that we love to help engineer. And my friend, PK's director of content, Derek Phillips, works with his teams to really get to the outcomes that are, both great customer experiences, but important business outcomes as well. Now, Kaiser is also a clinical organization, and some of you may have interacted with them. And this might look like a content hub, After all, we can see there's content and there are topics, and it's not that different than what we might have seen over on Orlando Health. But quickly, as you click into this experience, what you see this is it really is focused on conversion. What's the first link here? Get started. It really is a dialogue with a patient about what kind of education would you need, what would you need to know about us in order to start the journey to care. And as you click through on Get Started, you can even see that it segments out. These are the different ways that you can engage us in your first step of care. And I want you to see that the phone is really important. It interrupts shopping. In person may be how people want to do that. And they want to know if there's geographic proximity, and they help them take that one step at a time. Or likely they may want treatment remotely or by televisit. And all of that is part of this conversion path, which once someone uses one of these resources, they're not going to continue to come back and continue to learn from that kind of hub. But here's a rich example of how content is being used to get people to move from considering care to starting to plan it. Finally, I want to share BayCare, which you may know is in Clearwater, Florida, as they've made this kind of ingenious, it's like an engagement hub, but it really is taking people from point A to point B. They've taken 4 elements that you see featured here next to the little red triangles. And these are things that any hospital would have. Online appointment reminders, yeah, we want people to sign up for that. Monthly newsletter, yeah, we want to personalize it. Tell us what you're interested in, and the same with online appointments. So these are things that will help them drive better digital engagement, but they wrap them together as a VIP program. And they have actually turned this into a strategic asset. First, because they're gaining engagement with their system that's going to give BayCare better reach to repeatedly come back and interact with these customers in a very positive way. And that monthly newsletter, it has interest segments that patients can elect. And the segment for people approaching Medicare age, that's their strategic part, because as BayCare was launching this newsletter, they were also getting ready to launch their Medicare offering. So why not enrich their house list so that they can do that better while they're also engaging people and getting them onto the portal and helping them show up for appointments, which are all things that are an intersection between patient need and system desire. So just a little bit of integration. Let BayCare turn a few of those boxes on the chart into the beginning of a digital front door and into a very positive experience. And that offer, just this offer of do these things and you'll get a prize, you'll get a gift, that's just an engagement point. So it's a great use of an engagement point to drive a much better joined together digital experience. So I'm going to turn back to Derek, who has some thoughts about these teams and the ways that great content strategy can be applied to this, and the ways that also may change and enable us to work better in this hub or doorway focused world rather than in a page focused world.
Great. Thanks, Dave. So yeah, everything we've been talking about so far today is really a deeper investment in content. And for those of us who are in the content world, either as a content strategist or manager on the operational side, that can sound daunting because we're plenty busy as it is. But there are some opportunities here for us to think differently about our content in healthcare. And what we're going to do is think about where our opportunities are and how we can really learn from the best that are out there and start to apply some lessons from them. When I think about content and start the conversations with clients in thinking about their content approach, we always start with the 4 tenets that really make up for useful and valuable content. Is it unique? Is it exclusive? Is it engaging? And is it creative? And here I have a handful of examples that we can learn from. Airbnb does an amazing job of creating unique content, especially for a company that's not their core business, is to create unique content, but to make connections for travelers and hosts. They do an incredible job. They focus a lot on creating these stories that highlight not only the unique properties that you can explore through their services, but the unique hosts, the individuals that you might interact with, all of which is told in a story fashion. And so they've created a number of these host stories that really get you excited, engaged to go out and explore what's really out there and to book your next trip. Exclusivity. We think about what information do we have that nobody else has, or what expertise can we share that nobody else has? And Masterclass is maybe a service a lot more of us are thinking about right now. I know my family's been looking into it, but it's a cool program that puts you in direct contact with some content from the people who are literally the best in their businesses or the best in their particular discipline. Photography from Annie Leibovitz, or creativity and filmmaking from different directors or artists that are out there. It's a really cool approach to learning, but it's focused on exclusivity, getting the access to knowledge that you wouldn't otherwise be able to get. And I think all of us have some exclusive stories that we can tell about either our industry or our particular business that nobody else has. And the trick is really thinking about and finding those stories. Nike is obviously one of the biggest and most well-known brands in the world, built on this idea of exercise and fitness and competition. And so they've invested in a lot of videos that engage their target audience to do more of those activities. Especially now, while a lot of us are in some phase of lockdown, it's harder to get out there and play sports. And so they have these videos that are showing how you can exercise from home, or different games that you can play, all of which supporting their core brand message of getting out there and just doing it, right, and being active. And then the last pillar here is probably my favorite, not just because it's more fun to think creatively, but because this is my favorite example. The New York Public Library system right now has launched Insta novels on Instagram. And what it is it's these little stories. They've taken these really well-known novels, or novels that are maybe new and starting to get a lot of attention, and packaged them into these short little chapters on Instagram. The upside is they've seen a huge increase in followers and interaction with their feed. So it's a really interesting way of how they've taken a new kind of media channel for them and really applied a different way of thinking about it to encourage that interaction. So we also have to identify where our opportunities are, right? And like I said, this is a deeper investment in our content. And if we think about content as a business asset, it requires that investment, but it also means we have to choose carefully where we're going to make those investments. And what I like to think about and talk about in these situations is we really want to understand 4 things about our most likely customer. And that's the mindset. So what are they thinking at a particular point in their journey? And is there something that we can do to support that thinking or to alleviate it? A lot of times we can think about, especially in healthcare, what is the mindset when somebody's on the page looking for emergency room information? They're probably at a heightened state emotionally. And so we can, if we understand that mindset, we can adjust our tone and focus our information to really support or alleviate that mindset. What are their motivations? Why are they looking for this information in the first place? And what can we do to help propel them down that path? There's a lot of information that we can think about in surface if we understand why the user is there in the first place. Likewise, what are the roadblocks that people are likely to encounter at different phases of their journey, especially when we think about various insurance forms or pieces of information or identification they might need to get to the next step. If we can highlight that to them and really give them a good sense of we understand their journey and we're helping them along, that makes for a much higher patient satisfaction And then the last piece, or the last kind of thing I think about, is content consumption habits. How is the best way to deliver this information? Is it a 5-minute video, or is it really 3 bullet points? All of which in the context of the 3 bullet points above, right? So we really want to just understand who our customer is and what they're going through so that we can focus our information on supporting them. From there, we can establish our editorial approach. The key is not to compete with other services out there like WebMD or Wikipedia, which sometimes early in conversations, clients will tell us they want to do, like, I want to get out there and I want to compete against WebMD. They're stealing a lot of my search traffic. Well, you're never going to compete against WebMD unless you're willing to invest the kind of editorial resources they do. That's their core business. That's not your core business. So what we want to do is not compete with those sites, but to complement them and to add something new to the conversation. So what's a story only you can tell? Again, we're thinking about exclusivity, right? There are the stories, or there are things that you know about your business or your target communities better than anybody else. And so let's tell those stories. Who inside your organization are the keepers of those stories? They don't have to be content creators. They don't have to be writers or content producers to be able to tell those stories and to help share those stories. You can interview those folks. We all know people within our organizations who just know all of the great stories that are going on around the organization. Go talk to them and see what they're thinking about. What are your patients asking for? Talk to the call center. Talk to intake in charge nurses about what's going on. Also, what are other people in your industry or outside doing? And your library is doing with new channels. That's something that we can learn from and apply our own spin on. Where are there ways for us to use those new channels in a different sort of way to really engage our patients in an ongoing basis? All of which means we need to have a consistent and constant approach to managing these systems in these properties. And again, early in the presentation was when Dave was talking about our silos. That can be a little daunting to those of us who are responsible for managing all of these properties and systems. And so we have to think about what's the best way for us to consistently and constantly monitor and manage those systems. When we look at content operations, there are essentially 4 phases of an engagement or a process, a content operations process, where we assess and plan. So what do we have today? What do we have to work with? Then we start to author and collaborate with folks. Remember, we can reach out to those storytellers within our organization and collaborate with them. We got to manage and curate all of our content and ensure that it's meeting those needs that we've identified for our patients. And then we're going to put it out there and see how it's performing. We want to measure, so this becomes a loop, a feedback loop into our constant management process that should feed right back into our assess and plan phase of the work. So again, it's a lot to take in, and that means there are some pain points that a lot of our content operations teams run into. A lot of those pain points are going to sound familiar to you guys. It's the amount of time it takes for people to find content or to find assets. They're distributed in a number of different spreadsheets or servers. They're all over the place. We have duplication of content across these different channels with really no single source of truth. I don't know which version of this pamphlet or this ad is the one that's approved and out there, or I don't know if this doctor bio is the latest and we can use to promote in an upcoming event. We need to have a single source of truth for that, which slows us down when we're trying to get to market and makes it difficult to find these assets, but also to reuse them so we're not recreating assets unnecessarily. And then that can lead to creative frustration and fatigue, like our teams start to become disengaged. So, obviously we're presenting this with some support from Sitecore, and it's because they have a tool, the Content Hub, that we're actually really excited about and addresses a lot of these pain points and creates new benefits for content managers and operations. Where in the assess and plan phase of things, we can look at our content production process and really mobilize it by having calendaring capabilities, having one clear view at all of our assets and understanding where they are in process. We can have a strategic and creative ideation process together as a team within one interface. So again, just from the assess and plan phase of things, it's helping to promote and to really facilitate our work, which is pretty exciting to a content manager like myself. It also allows us to collaborate again with our workmates. So we could share files, we could create these workspaces focused on a particular project, and then we can edit our work together and have conversations within the system. Again, what happens a lot today is this work is going on. It's just broken up into a number of different interfaces, and we start to lose track of conversations that we'd have, or we start to lose track of work that we've already completed.
Yeah, I would suggest that those are like silos inside of the authoring process.
Well, that's exactly right, and especially right now, as a lot more people are working from home or in distributed teams, that becomes even more challenging. The reality is while we're in a moment in time right now, this is likely to become the new reality for a lot of us as we have tools available to facilitate more collaborative working. That also, by the way, gives us access to a larger pool of talent if we don't have to only focus on our physical location for coworkers. And then when we manage and curate our experiences, it can be difficult again to keep track of our versions and the rendition availability. What that really means is being able to go back and look at when we made changes last, what were those changes and what were the discussions around those changes so that we can understand why an edit was made or why we made a different decision on our approach. So it really helps to again be more efficient in our work and also more accountable in our work. Lastly, we have publish and measure, right? The whole point of this is to get our work out there, to be able to communicate with our patients or our target audiences. And so we've got a variety of channels. Here's a quick example of a couple of content models that we use from Airtable. We use as a foundation and then build onto this so that we can again get working more quickly. The real key benefit of having a model like this in place is we can not only understand all of the pieces of information we want to make sure are accounted for, but this sets up the foundation for a personalization, localization, and translation process for us. If we can really identify the pieces of content, the components of content that we're going to be working with, then we can more effectively focus on those pieces and make deeper content investments. All of which means we have tools and systems to support this work, and Jeff's going to talk us through some of the technical aspects of the work.
Yeah, hey, thanks, Derek, and hey, everyone. Just a few real closing thoughts. I mean, I think to build upon what you heard from Derek and Dave, I mean, what we're seeing with the healthcare organizations that we talk to is we're all swimming in this sea of MarTech, and as you think about your own MarTech stack, hopefully you don't have 8,000 like Scott Brinker indexes here. But we have a complicated set of systems that don't always allow for those seamless experiences that Derek and Dave mentioned. And I think if you remember the silos that Dave talked about at the beginning, I think our job in assembling these experiences is really to look at the points that connect. And so as we think about how to rationalize that, and I think as you think about your own MarTech stacks, I'd offer just a few trends we're seeing from healthcare leaders. This idea of thinking in hubs is really important. So because they connect and they kind of federate and they enrich your existing investments in other systems. So as you think about the delivery layers, this idea of a content hub, as Derek mentioned, is really important because it starts to unlock content from where it lives and make it repurposable, manageable, and really focus more upstream on some of the content production activities that will drive things like at-scale personalization and just frankly cost reduction in the management of these assets. And this hub concept, I think, increasingly will be a really important one as we try to oftentimes do more with less and just get more from the existing systems that we're working with. So if we put content in the center of that as we think about connected experiences, it really allows us to move from maybe personalization as a pilot, which I think is what a lot of us are doing, to really personalization as a program and something that can scale. And so we've got an interesting way of looking at that as we look across the way that scales. And I think as you think about your own content operations and the way that you streamline its creation and governance, we really see a few critical kind of prerequisites for making that happen. And so as kind of a leave behind a next step, we put together a really simple survey on the PK website that you can all go to. It's at pkglobal.com/content readiness. This is just 10 or 12 questions. As we worked across health systems and kind of looked at what's in place as a kind of prerequisite to enabling these connected experiences, we really seen kind of different levels of maturity and starting points. So we put together kind of a simple kind of benchmarking survey. What we'll do if we fill that out, we'll take that back and kind of give you a readout against some of the trends we've seen and kind of put it into perspective in terms of where you're at compared to some of the organizations we work with and maybe where useful starting points are. So it's really a quick, about 5 minutes probably to get through it. Just hop on over to pkglobal.com/content readiness. But on behalf of Dave, Derek, and myself, and we're super passionate about the space. We're really inspired by the work you're all doing to build these connected experiences and look forward to ongoing conversations with you all. With that, I think we've got a few minutes for Q&A. Dave or Jane?
Yeah, hi. This is a great presentation, guys. And we do have a few minutes, so let's get started. The first question is about Zimmer Bionet. Is Zimmer Bionet tapping into patient-reported outcomes as part of their strategy?
So could you repeat the question? Are they tapping into patient outcomes?
Yeah, as part of their strategy.
Yeah, so what they're focused on even at the core of their business, as part of their mission statement, is to help restore balance to patients. And so yes, they want to ensure that patients are having a better kind of outcome, and also again having those realistic expectations. So yeah, they ask for patient stories and share patient stories that are focused on those outcomes as well.
Okay. In a post-pandemic, well, actually, we're not really post-pandemic, but in a pandemic world that we're recovering from, what would you say the priorities are in terms of content creation and the content hub strategy?
So I'll jump in first, and Dave, I'm sure you have some thoughts on this as well. Again, anything that we can do to help facilitate task completion. If there are things that maybe we used to do online but can be accomplished, or that we used to do offline that we can accomplish online, is always a bonus. But I think not only in regards to the coronavirus that's going on and what's happening out there, but as patients who are also consumers out there get more and more used to digital interactions in all aspects of their life, they start to demand more of those digital interactions. And so I think that this is really an opportunity for healthcare and medicine to take advantage of that and to jump forward with that. And Dave, I think you were touching on this a little earlier as well.
I had reference work going on with Mayo, who's built really a content hub around wellness, which they've created an access on for COVID-19. So we've seen them use their content hub to align to let us present all of the materials we have for someone who has this as one of their concerns. And they've, rather than building a new part of the website, built that out as a new informational piece on their wellness content hub.
Okay. Here's another question. To what extent must you change the underlying operations versus just a marketing strategy? What about the back end?
Well, first, I think that integration allows people and challenges people to work in new ways. If you think about the journey to care, that's really not just a marketing responsibility. When someone picks up the phone, they're talking to operators or healthcare navigators, and that's operations. So one of the opportunities is once you start thinking about a journey experiences, that becomes a map for bringing people together to work in tandem who otherwise might just be working on a piece of that journey that would be disengaged. So I think that the journey map approach can unify, both the technology back end, but also puts people together in new combinations.
Yeah, I would agree with that. And Dave, we had a workshop where we had an oncology nurse come in and participate with the marketing team on what a patient journey was actually like. And she was by far the most valuable person in the room.
Okay, last question I think we're going to have time for. What's the best way to find and evaluate a CMS and related systems for implementing a content hub?
I'm going to see if Jeff wants to weigh in on that. I have a starter idea though. So Jeff?
Yeah, hi everyone. I guess I'll pop on the video for that one. Good to see you both. Yeah, this is a really I think important topic. We see a lot of health systems kind of reevaluating their approach to CMS in part because one of the things that's happening right now is the content's becoming more distributed. So we at PK have a process that kind of we help organizations take through. But I think having it be very use case and kind of scenario driven is kind of the first step, I'd say. And then making sure that you look at it in the big picture and really understand the role that you expect the content platform to play in your overall MarTech stack. So not going back to the 8,000 logos, but there's a lot of different types of content platforms now. The one that Derek showed from Sitecore is really interesting because as a content hub, it really plays a more connected role. So it works alongside existing content platforms as well. But we'd be happy to take that offline as well to provide some guidance. I think the way that kind of headless experiences and other distributed experiences are assembled, it's really a matter of looking at the entire content ecosystem and then making sure you're in the right category of solution that you are looking for.
Increasingly, as we invest in systems, does it have an easy and open data exchange, and will it play well with others? And that's a place where Content Hub is useful, but really anytime you're adding something to the ecosystem, it needs to be able to participate in that open data exchange so you can join your experiences together.
Okay, any final words on that? All right, so that's all the time we have for questions. So we'd like to thank our presenters, Dave Wieneke, Derek Phillips, and Jeff Cram from PK for their excellent presentation. And thank you attendees for participating in the Q&A. And our thanks to PK for sponsoring today's program and also for sponsoring the 2020 eHealthcare Leadership Awards. The call for entries for the awards is now open and entries are due by June 30th. To submit an entry or to learn more, visit eHealthcareAwards.com. Just as a final reminder, we'll send the link to access the webinar recording as soon as it's been processed and is available for viewing. So thank you for attending, and we hope to see you at our next webinar. Enjoy the rest of your day.
Thank you.
Thanks, everyone.